Now, moving on to the practice questions for heart failure. Question number 1. The nurse is assessing a client with the diagnosis of right-sided heart failure. Which signs and symptoms are expected? So pause the screen and try your best to answer this question in about 60 seconds or less. All right, so let's break this question down. Following the question breakdown strategy, we always first look for the key terms inside the question. So this question states right-sided heart failure. And the question's asking which signs and symptoms are expected. Now, before looking at the options, always think of a few things you know about those key terms. So remember, R for right-sided heart failure, think R. It rocks the body with fluid. So the body fills with fluid and not the lungs. So we see weight gain inside the body. This means water gain. We see edema, that waterbed skin, as well as bounding pulses and even high blood pressure, as well as JVD, that jugular vein distension. Okay, now look at the options here. So option A, crackles and dyspnea. No, this is typical for left-sided heart failure that affects the L for lungs with crackles. Fluids inside the lungs cause this dyspnea, that difficulty breathing. Now option B, peripheral edema and jugular venous distension. Yes, remember, right-sided heart failure rocks the body with fluid. So we see this peripheral edema, that waterbed skin, and JVD. Now these are classic signs. Now C is incorrect because dyspnea at rest and pulmonary edema. No, remember, dyspnea is that shortness of breath, and pulmonary edema is that edema inside the lungs. So remember, L for left-sided heart failure, you have to think L for lungs. Now D is also incorrect. Inspiratory wheezes and hypoxemia. No, this is incorrect because again, it mentions the lungs here primarily. And this question's talking about wheezing, which is not a typical sign of heart failure. Wheezing and hypoxemia is usually from asthma attack, where the inflamed bronchi become narrowed. Now moving on to question 2. The nurse caring for a client with left-sided heart failure auscultates crackles in the bases of the lungs. What is the pathophysiology of this abnormal finding? So once again, pause the screen and try your best to answer this question in about 60 seconds or less. All right, let's break this question down. So following the question breakdown strategy, we always first look for the key terms in the question. So this question states left-sided heart failure. So remember, L for left-sided heart failure, you must think L for lung fluid. And the question states crackles in the bases of the lungs, indicating that there's fluid inside the lungs. Now the question's asking for the pathophysiology of these crackles. So just think about a few things you know about the patho of heart failure. Remember, HF in heart failure, the heart fails to pump blood forward, and now the client ends up with HF, heavy fluid in the body or lungs. In this case, with left-sided heart failure, it's the lungs. Okay, now look at the options here. So option A, failure of the heart to pump blood from the right ventricle into the lungs. Okay, this was super close, but it's incorrect. This is indicative of right-sided heart failure, where that right ventricle is pumping. So always look at the key terms here. This one is talking about left-sided heart failure, not right-sided. Now B, failure of the mitral valve causing blood to re-enter the left atrium from the left ventricle. Incorrect, but a little bit close here. Now it does say left atrium, so I can see if you got confused. But this mitral valve malfunction is not a direct cause of heart failure and even crackles inside the lungs with that heart failure. Now option C, failure of the aortic valve to close during systole. No, again, this question is incorrect because it's talking about a valvular malfunction and not a failed pump of the heart in heart failure. Now D, failure of the heart to pump blood forward into, key term here, systemic circulation. Yes, This is the most correct here. Because remember, heart failure, the heart fails to pump blood forward into the body, specifically with left-sided heart failure. So the left side of the heart fails to pump blood forward into that systemic circulation. Fancy words for to the body. So the blood ends up backing up into the lungs, causing crackles. All right, that wraps it up. Thank you so much for watching. Don't forget to take your quiz and download the study guides. And also feel free to share the love, share with a classmate, and even your instructor. See you guys in the next videos. Now for congenital heart defects. This is an abnormality in the heart that develops before birth, where one or more problems within the heart structures changes the way blood flows through the heart and out to the body. Now in terms of risk factors, genetics plays a huge role. So family history of heart disease and Down syndrome predisposes a child to congenital heart defects. And even during pregnancy, if the mother has infection like rubella, or uses alcohol or drug abuse, and even diabetes. All these things are huge risk factors. Now, in terms of the types, we're going to break down all the pathophysiology, signs and symptoms, and treatments for all the top tested cardiac defects. But first, let's cover some key points that apply to all of these. As you know, in a normal healthy heart, deoxygenated blood is vacuumed back to the heart via the veins, through the vena cava and into the right side of the heart, then pushed into the lungs to get oxygenated. After that, this oxygenated blood is pushed to the left side of the heart to be pumped out to the body. This is called cardiac output, meaning oxygen-rich blood out to the body. But with these heart problems, less blood is pumped out of the heart, resulting in decreased cardiac output, meaning less oxygen-rich blood out to the body, resulting in big complications like abnormal heart rhythms, murmurs, heart failure, and hypoxia, that low oxygen in the blood. So in terms of complications, the most deadly complications are usually the most tested. So please be sure to write this down. Hypoxia, that low O2. Most common in right to left blood flow problems, like in TOF and TGA. So the memory trick, if it starts with a T, then think trouble. So look at the T's here. T for tetralogy of Fallot, that TOF. T for transposition of the great vessels, TGA. So these are the two most tested. So please be sure to write these down. Now the last two T's, we have truncus arteriosus and also truncus atresia. Now we'll break these down one by one in a moment. But first, you must remember that these are priority, since low oxygen is always a priority on the NCLEX, since it's the most deadly here. Now, this hypoxia leads to blue babies, as these defects take blood away from the lungs and push it to the left side of the heart. So, top signs and symptoms to write down is number 1, cyanosis, that blue skin. So, Hesse mentions a child's bluish color. The child has cyanosis associated with lack of oxygen. And the next sign and symptom to write down is poor feeding and poor weight gain. From that lack of oxygen, it's harder to breathe during feedings. So Kaplan mentions the nurse knows a cyanotic congenital heart defect is associated with which symptom? Poor feeding with no or very poor weight gain. The next sign and symptom is clubbing fingers. Those thick, spoon-shaped fingernails from that low oxygen. So Saunders mentions an infant with congenital heart disease, chronic hypoxia. We're most likely to see clubbing of the fingers. The next sign is dyspnea as well as tachypnea, that difficulty breathing and fast respiratory rate. Now, a big sign here is polycythemia. This refers to an increase in number of red blood cells within the body. So, huge blood clot risk. So please be sure to write this down. We always report a hemoglobin level over 22. Huge NCLEX tip. Now, this is priority and must be reported to the healthcare provider. So please be sure to write it down. Many students get this wrong. Now, here's why. Due to the hypoxia in the body says, oh snap, I better make more oxygen carriers. So hemoglobin is produced to compensate for this low oxygen. But instead of perfusing the body, these extra RBCs cause a big old traffic jam within the blood vessels. Basically meaning thick, viscous blood that can easily clog tiny little blood vessels and form a deadly blood clot, specifically in those tiny blood vessels within the brain. Now, this blood clot can cause a deadly stroke, a CVA, a cerebral vascular accident. So this is why we must report any hemoglobin over 22. Now, the priority intervention is hydration. We basically want to dilute the blood and decrease the risk of blood clumping together and forming clots. So Hesse mentions polycythemia, highest priority, maintaining adequate hydration. And question number 2 here. Primary reason for a newborn with congenital heart disease to be kept well hydrated, to reduce the risk of a cerebral vascular accident, a CVA. Fancy words for a brain stroke. Now, Kaplan mentions cyanotic congenital heart defect. The nurse understands that chronic hypoxia from this disorder can result in which finding? Polycythemia. Now, switching gears to CHF, congestive heart failure. This is most common in left to right heart defects, with ASD, VSD, PDA, as well as AVSD, and PIMP. I'm just kidding. Okay, these are far less deadly than the right to left problems, as hypoxia is not a primary problem here. So these defects are from holes in the heart septum that push blood from the left side of the heart to the right side, into the lungs, sort of overloading the lungs with too much blood flow. So remember, HF for heart failure, HF for heavy fluid in the body and not in the potty. So the key signs to write down here. Number 1 is weight gain. Remember, think water gain. Huge NCLEX tip here. Heavy fluid in heart failure. So the number 1 sign here is pale with cool extremities due to that reduced perfusion in the body. Number 2 is puffiness around the eyes, known as paraorbital edema, from that water gain. And number 3 is a reduction in number of wet diapers, from that decreased blood flow to the kidneys. The body's holding on to this water. Now the next sign is diaphoresis, as well as a big one here, grunting during feedings. Huge NCLEX tip. Now this is from increased effort on the heart during feedings. We also see dyspnea, as well as tachypnea and tachycardia, and poor weight gain from all that strain on the heart during feedings. Now lastly, switching gears to obstructive defects with stenosis, like pulmonary and aortic stenosis. So for stenosis, think stiff. We find stiff valves here, making blood flow through the pulmonary and aortic valve very, very difficult, resulting in a backup of blood, increasing the workload on the heart. So let's break these down one by one, starting with the most deadly, since the most deadly is typically the most tested. So for congenital heart defects, the types that are right to left blood flow problems. So once again, think if it starts with a T, then it's trouble, since it results in oxygen problems as there's decreased blood flow to the lungs. So the first T is for TOF, tetralogy of Fallot, where we have 4 defects in 1. The second T is TGA, the transposition of great vessels, also called transposition of great arteries. Now, once again, these are the top two most tested since they cause the most trouble. But we also have tricuspid atresia and truncus arteriosus. Again, they are right to left cardiac shunts. So just think it ain't right to have a right to left cardiac shunt, as blood is pushed away from the right side of the heart and to the left side, taking blood away from the lungs, resulting in that low oxygen and blue babies from hypoxia, since the lungs are bypassed here. So Saunders mentions a child diagnosed with a right to left cardiac shunt, which is the most common assessment finding: bluish discoloration of the skin. Yes. Okay, now starting with the most tested of all the cardiac defects, be sure to pay attention here. TOF, tetralogy of Fallot. Once again, we have 4 defects in one. So just think, tetra means 4. Kind of like that video game Tetris, where we have 4 boxes in the game. Now you must know all 4 defects, so we use the memory trick PROV. P for pulmonary stenosis, that stiff, narrow pulmonary or pulmonic valve. R for right ventricular hypertrophy, that thick heart muscle. O for overriding aorta, where the aortic valve is misplaced, on top of the V for VSD, a ventricular septal defect. Fancy words for a hole between the ventricles. Now the signs and symptoms are key. You must know TET spells. Be sure to write this down. It's always tested. The baby turns blue when crying from this insufficient blood flow to the lungs. So we'll see blue babies here. This is cyanosis. And we also see hypoxemia, this oxygen saturation between 65 and 85%. Now in long-term patients, we see clubbing fingertips, as well as polycythemia, as mentioned before. Huge blood clot risk. So remember, we always report any hemoglobin level over 22. Huge NCLEX tip. As mentioned before, this is priority and must be reported to the healthcare provider. Because the prolonged tissue hypoxia, we have increased RBCs that clog the blood vessels, leading to those deadly blood clots. That's why we must always report any high hemoglobin over 22. Now, speaking of nursing actions, let's talk about hypercyanotic spells, those TET spells. They usually occur during moments of stress, like crying, hunger, or even during feedings, as well as painful procedures like an IV insertion, or even upon waking up from naps or in the morning. So the 5 NCLEX tips to write down in terms of interventions. So during an episode, number 1, for infants, put those knees to the chest. Now for older children, they're going to assume a squatting position. This helps to return blood to the lungs and also reduces the shortness of breath or less dyspnea. Now in terms of prevention, number 2, do not interrupt sleep, as this can trigger a TET spell. And provide a calm, quiet environment upon waking, as TET spells usually occur most often during awakening. Now number 3, offer a pacifier during crying. And number 4, small frequent feedings to decrease that workload on the heart. And lastly, number 5, swaddle or hold the infant during procedures to provide more comfort and prevent the child or infant from crying, which can trigger a TET spell. So ATI mentions a child with cardiac defects assumes a squatting position for less dyspnea or less difficulty breathing. Now Hesse mentions an infant which actions when a hypercyanotic spell occurs, or a TET spell. Knee to chest position. And now Saunders goes a little further and says tetralogy of Fallot, who is experiencing a hypercyanotic spell. Order of priority. So this is an order response. Number 1, knee to the chest position. Number 2, 100% oxygen. Number 3, morphine sulfate as prescribed, an opioid pain med. Number 4, IV fluids. And lastly, we document. Now in terms of treatments, we always do surgical repair soon after birth. But the exact surgery is not really tested on. Rather, the focus is on post-operative care. So Hesse talks about tetralogy of Fallot repair, Which postoperative finding indicates that repair is successful? Select all that apply. So absence of cyanosis when feeding, lips are pink while crying, and a respiratory rate is 32 breaths per minute. Now, in terms of discharge instructions, after heart surgery, the heart is weak and often fails to pump correctly, causing right ventricular hypertrophy, decreased cardiac output, as well as heart failure. So we must teach parents about spotting the deadly signs of heart failure and report these signs to the healthcare provider. So write this down. 5 heart failure signs to report. All are NCLEX tips, and they love to come up on Select All That Apply questions. So remember, HF for heart failure, just think HF for heavy fluid in the body. The heart's not pumping that blood forward. So number 1 is weight gain. So remember, weight gain means water gain. The blood is backing up inside the body here. Now number 2, puffiness around the eye, known as periorbital edema from that water gain. Number 3 is pale, cool extremities due to the reduced perfusion to the body. And number 4, a reduction in the number of wet diapers from that decreased blood flow to the kidneys. And number 5, decreased feeding due to fatigue and difficulty breathing during feedings. So I'd be sure to pause the screen and write down these top tested 5 key signs for heart failure. Now switching gears to TGA, transposition of great vessels. This is the reversal of the 2 main arteries leaving the heart, the pulmonary artery and the aorta. If left untreated, 90% of infants will die within the first year of life, and 50% die in the first month. So the treatment, surgical repair, is a must. Now the next T is tricuspid atresia. We have closure of the tricuspid valve and ASD, an atrial septal defect, as well as VSD, a ventricular septal defect, basically a hole between the ventricles. So naturally, blood from the right atrium cannot enter the right ventricle, since the tricuspid valve is closed. Therefore, blood must flow through the hole connecting both atria and finally get to the right ventricle via the holes in the ventricles through the VSD. And the last T here is truncus arteriosus. We have a connection between the aorta and pulmonary artery. And we also have a VSD, a ventricular septal defect. This results in a mixing of oxygen-rich blood and oxygen-poor blood. But again, these last 2 are not commonly tested, so I'd focus on the first 2 mentioned. Now for left to right blood flow problems, where we have increased pulmonary flow, or basically increased lung blood flow. We have ASD, the atrial septal defects, a VSD, ventricular septal defect, a PDA, public display of affection, I'm just kidding, patent ductus arteriosus, and AVSD, atrioventricular septal defect. Woo, that's a lot. So to make this really simple, blood is pushed from the left side of the heart, where it already has oxygen, back to the right side of the heart. This is what's known as a left to right cardiac shunt. So this excess blood flow gets forced into the lungs, causing lung congestion, or pulmonary congestion. This makes it very difficult to breathe, with decreased lung compliance and increased risk for heart failure. So the 4 NCLEX tips to write down. Now these are key signs. So number 1, diaphoresis during feedings, or basically sweating during feedings. Number 2 is a heart murmur. Number 3 is poor weight gain. And number 4 is an increased risk for heart failure and pulmonary hypertension. So please be sure to write these down. They love to show up on Select All That Apply questions for left to right cardiac problems. Now let's break these down one by one. So for atrial septal defect, or ASD, there's a hole between the atria. Now the big symptom to write down is a murmur. This is normal and to be expected. Huge NCLEX tip. Be sure to write this down. Many students get this wrong. So remember, murmurs are expected, not muffled heart tones. So remember, muffled heart tones, that's for cardiac tamponade. So don't let the NCLEX trick you here. Murmurs are normal and to be expected with ASD. Now, in terms of treatments, it usually closes on its own, but if it doesn't, then surgical repair easily closes it. Now, for VSD, ventricular septal defects, there's a hole between the ventricles, that septal opening. So for symptoms, grunting during feeding is the number one NCLEX tip. We see increased respiratory effort. Now, this is priority and must be assessed, since ABCs, airway and breathing, and then circulation. So this is a breathing problem. Now, the second symptom is a systolic heart murmur, heard on the left sternal border. This is a classic finding here for VSD. And for treatment, it's the same as ASD. It usually closes naturally, or surgical repair can be used. Now, in terms of PDA, patent ductus arteriosus, we have an opening that connects the aorta to the pulmonary artery, sort of like a highway. So the symptom, a classic sign, is a loud machine-like murmur, huge NCLEX tip, as well as poor feeding, but this is to be expected, like all the other heart conditions. So the big memory trick here, think loud machine-like duck with patent ductus arteriosus. Now, it typically closes by itself within 48 hours after birth, but for a premature infant, the big treatment is indomethacin, which is an NSAID to close the hole, or even surgical ligation, where the surgeon goes in and sews the hole shut. So Saunders mentions a machine-like murmur on auscultation of the heart and signs of heart failure. Which disorder? Patent ductus arteriosus. Yes, remember, loud machine-like, think duck for patent ductus arteriosus. And Hesse mentions a surgical repair for patent ductus arteriosus, PDA, is performed to prevent which complication? A worsening of pulmonary vascular congestion. Fancy words for lung congestion from that increased blood flow to the lungs. Now lastly, AVSD, or arterioventricular septal defect. We technically have both ASD and VSD. So we have two holes here, one in the atria and one in the ventricle, commonly seen in babies with Down syndrome. Now switching gears to stenosis, where we have stiff valves. So memory trick, S for stenosis, think S for stiff and narrow. When blood flow attempts to leave the heart, it meets resistance from these narrowed valves. This blocks blood flow and now backs up into the heart, resulting in decreased cardiac output, meaning less oxygen-rich blood out to the body. So first up is pulmonic stenosis, also called pulmonary stenosis, where the pulmonary valve is stiff, small, and narrow. This causes increased pressure and strain on the right side of the heart, as the right ventricle tries to push blood through this tiny opening. In result, this causes right ventricular hypertrophy, a big hyperinflated heart muscle in hypertrophy. So for the symptoms, right ventricular hypertrophy or hypertrophy as the muscle beefs up from all this pressure, and a loud systolic ejection heart murmur, sounding like a whooshing sound. But this is a common expected finding. Now, in terms of the treatments, a balloon angioplasty can be used where we inflate a balloon in the valve to open up that narrowing, and also surgical repair, a valvotomy. Now, switching gears to aortic stenosis, where the aortic valve has narrowing, which reduces blood flow to the body. So we get some classic signs and symptoms. We get decreased cardiac output, meaning decreased oxygenated blood out to the body, as well as activity intolerance from low oxygenated blood out to the body. And in terms of vital signs, we have low blood pressure as well as tachycardia, that fast heart rate, and even left ventricular hypertrophy or hypertrophy, as all this blood backs up into the left ventricle, making the heart work harder, forcing the left ventricle to beef up and become thick. And we also see pulmonary congestion, as blood flow backs up even further, going into the left atrium and even the lungs, causing congestion inside the lungs. So Hesse had two questions. Pathophysiology of a newborn with aortic stenosis. Select all that apply. Decreased cardiac output, left ventricular hypertrophy, as well as pulmonary vascular congestion. And question 2, which cardiac defect causes narrowing of the aortic valve? Aortic stenosis. And Saunders mentions suspected aortic stenosis. The nurse expects which clinical manifestation? Activity intolerance. Now the treatments are the same here. We have balloon angioplasty as well as surgical repair or valvotomy. Now switching gears to COA, coarctation of the aorta. We have a narrowed aorta. So we find decreased cardiac output, meaning decreased O2 blood out to the body, specifically in the lower extremities. We have increased blood flow is supplied to the upper extremities, the arms, and decreased blood flow is supplied to the lower extremities, the legs. So for the key symptoms, the upper extremities, we find high blood pressure and bounding pulses from that increased blood supply. And for the lower extremities, we find cool, low blood pressure and diminished pulses from that diminished blood supply. So Hesse mentions coarctation of the aorta. A child's initial assessment supports this medical diagnosis. Bounding pulses in the arms and cool lower extremities. Now in terms of the treatments, just like the stenosis, we can use a balloon angioplasty to open up that narrowing, and even stents that act sort of like a tent to help open up that narrowing. Now in terms of general treatments for congenital heart defects, we mentioned a few before, but they also include medications that lower the blood pressure and control the heart rate, and even heart devices, as well as cardiac catheter procedures. But again, surgery is usually the ultimate solution in most cases, and even serious cases may require a heart transplant. Now, most question banks did not directly test on any medication or direct surgery, but really more on cardiac catheterization. So pay attention to this next part. Cardiac catheterization involves inserting a catheter through the femoral artery near the groin and up to the aorta into the heart, used for a variety of procedures. So write this down. Before cardiac catheterization, allergy to iodine must be assessed. It's basically that contrast dye used during this procedure. And NPO 4 to 6 hours for children, and shorter NPO status for infants. This must be done before cardiac catheterization. Now we also report severe diaper rash. Huge NCLEX tip. Be sure to write that down. We always assess this since the catheter is inserted into the femoral artery near the groin. This rash can introduce bacteria into the bloodstream during this procedure. A big safety risk here. Now after the procedure, priority assessments, we must assess the pulses. So number 1, pulses distal to the catheter site. It's normal to have weak pulses. Big NCLEX tip. Write that down. Many students got that wrong. Now, what's not normal is to have a cool or cold or even pale extremity. Number 2, we straighten the leg for 4 to 8 hours after the procedure. And number 3 is the incision sites. We always assess for bleeding and infection. So make sure to teach the parents that there's no baths after this procedure, as it can introduce infection. All right, that wraps it up. Thank you so much for watching. Don't forget to take your quiz and download the study guides. And also feel free to share the love, share with a classmate, and even your instructor. See you guys in the next video.